Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. These interruptions, known as apneas, can occur when the muscles in the throat and tongue relax excessively, leading to a partial or complete blockage of the upper airway, obstructive sleep apnea, or when the brain fails to send the appropriate signals to the muscles that control breathing, central sleep apnea. As a result, individuals with sleep apnea experience disruptions in their normal breathing patterns, with pauses ranging from a few seconds to several minutes. The most common types of sleep apnea are obstructive sleep apnea, OSA, central sleep apnea, CSA, and a combination of both known as complex sleep apnea syndrome or treatment-emergent central sleep apnea. Sleep apnea can lead to a range of symptoms, including loud snoring, gasping or choking during sleep, daytime sleepiness, difficulty concentrating, and morning headaches. Sleep apnea can present various symptoms, and it's important to note that the severity of symptoms can vary from person to person. The most common signs and symptoms of sleep apnea include loud snoring. Persistent and loud snoring is a common symptom of obstructive sleep apnea. The snoring may be interrupted by periods of silence when breathing stops or becomes shallow. Pauses in breathing. Witnessed episodes of breathing pauses during sleep are a hallmark of sleep apnea. These pauses may be accompanied by choking or gasping sounds as the person starts breathing again. Excessive daytime sleepiness. Individuals with sleep apnea often experience significant daytime sleepiness, even if they think they've had a full night's sleep. This can lead to difficulty staying awake, especially during quiet or monotonous activities. Morning headaches. Waking up with a headache is a common symptom. This is thought to be related to changes in oxygen levels and increased carbon dioxide levels during episodes of apnea. Difficulty concentrating. Memory issues. Sleep apnea can contribute to cognitive problems, including difficulty concentrating, memory issues, and reduced ability to make decisions. Irritability and mood changes. Sleep apnea can affect mood, leading to irritability, mood swings, and increased likelihood of experiencing depression or anxiety. Restless sleep and insomnia. People with sleep apnea may experience frequent awakenings during the night, often coupled with difficulty falling back asleep. Frequent urination at night. Some individuals with sleep apnea may experience increased urination during the night, a condition known as nocturia. Sleep apnea can have various causes, and it often results from a combination of factors. The two primary types of sleep apnea, obstructive sleep apnea, OSA, and central sleep apnea, CSA, have different underlying causes. Obstructive sleep apnea, OSA. Muscle relaxation. During sleep, the muscles in the throat and tongue naturally relax. In individuals with OSA, this relaxation is excessive, leading to a partial or complete blockage of the upper airway. Excess weight. Obesity is a significant risk factor for OSA. Excess fat around the neck can put pressure on the airway, making it more prone to collapse. Neck circumference. People with a thicker neck circumference may have a narrower airway, increasing the risk of obstruction. Genetics. There is evidence to suggest a genetic component to OSA. Individuals with a family history of sleep apnea may be at a higher risk. Central sleep apnea, CSA. Central nervous system issues. CSA is primarily associated with a failure of the central nervous system to transmit the appropriate signals to the muscles that control breathing. This can be related to problems in the brainstem. Heart failure or stroke. Conditions that affect the heart or brain, such as heart failure or stroke, can increase the risk of CSA. Complex sleep apnea syndrome, treatment-emergent central sleep apnea. Combination of factors. Complex sleep apnea syndrome, also known as treatment-emergent central sleep apnea, can develop in individuals being treated for obstructive sleep apnea with positive airway pressure, PAP, therapy. Additional risk factors for both OSA and CSA. Age. Sleep apnea becomes more common as people age. Gender. Men are generally at a higher risk than women, though the risk for women increases if they are overweight, and it may also vary with age. Family history. A family history of sleep apnea may increase the risk. Smoking. smokers are at a higher risk of developing sleep apnea compared to non-smokers. Alcohol and sedative use. These substances can relax the muscles in the airway, contributing to airway obstruction.